Hello, I'm Lara Pizzorno, and this is our Ask Lara for this week. Today I'm going to talk to you about bioidentical hormone replacement in comparison to conventional hormone replacement therapy and the safety and efficacy of bioidentical hormone replacement, which I'm going to shorten here to BHRT rather than repeat that long string of words every time. So today's Ask Lara provides a brief introduction to BHRT, what it is, why it differs greatly from conventional HRT, and why it is so helpful for our bones. I will also discuss the research that shows BHRT can be used by women over 60 who did not begin BHRT during or immediately after menopause if they are properly tested before initiating treatment and are provided BHRT in transdermal creams made specifically to meet their needs by compounding pharmacies and are monitored with follow-up testing that checks their estrogen metabolites, so dosage tweaks can be made if they're needed. 2 lab tests can be used to do this. The Meridian Valley Lab 24-hour urine comprehensive plus hormone profile, which is the test I use myself, and the analytes of which we'll cover in detail in the next Ask Lara, and the Dutch test. I will explain each of these tests in detail in following Ask Laras. But today, I just want to share with you what bioidentical hormone therapy actually is. BHRT is treatment to restore declining human hormone levels to those seen in a healthy 30-year-old woman by supplementing with hormones that are bioidentical to human hormones. In other words, have the exact molecular structure of the estrogens, progesterone, testosterone, and DHEA that a woman's body itself produces. BHRT restores our former normal healthy levels of hormones, whose lack promotes chronic inflammation and bone loss, and also causes unhappy changes in skin, libido, mental acuity, and general vitality. So BHRT helps enable us to age vibrantly instead of just valiantly. After testing to determine what your current hormone levels are, and thus your specific requirements for supplementation, your prescription for BHRT should be tailored to specifically meet your individual needs. So the hormones that you need will be provided in just the right doses to restore your levels to those normally found in the lower range produced by healthy 30-year-old human women's bodies. Your BHRT prescription should copy nature as closely as possible. In addition to using exact molecular copies of the hormones that are supplemented and providing them in doses specifically calibrated after testing to meet your individual needs, BHRT further mimics nature by providing administration instructions that copy the ebb and flow of estrogen and progesterone during a healthy 30-year-old woman's natural monthly menstrual cycle. Thus, for women who had a typical 26 to 30-day cycle during their years when they were menstruating, estrogen is used on days 1 through 25 of the cycle, and progesterone is added during days 12 through 25. If testosterone is found to be deficient, it's used on days 1 through 25 along with estrogen, and DHEA is used daily throughout the cycle. Days 26 through 30 are days off when no estrogen, no progesterone, and no testosterone is used. Days 26 through 30 mimic the days of menstruation, although with the very low levels of hormones that are used in properly prescribed BHRT, having a period is unnecessary and will not happen. BHRT utilizes transdermal creams to deliver the hormones via a topical application to the vaginal labia. This is the area of the skin surface where the hormones are especially well absorbed and are delivered directly into the same pelvic veins that the ovaries use to send these hormones into our general circulatory system. Delivering the hormones transdermally via application to the labia rather than taking them orally as a pill that is swallowed is very important. The reason for this is that hormones taken orally are immediately sent to the liver, the body's screening and detoxification organ. and they are changed in the liver, okay, into more potent and potentially cancer-causing forms of estrogen, a particular form called estrone, or estrogen metabolites that can promote cancer. When taken orally, estrogens have also been shown to increase our risk for blood clots, insulin resistance, and type 2 diabetes. Topical administration of bioidentical estrogens has the exact opposite and highly beneficial effects of decreasing insulin resistance, improving blood sugar control, and decreasing risk of cardiovascular disease and diabetes. Bioidentical hormone replacement should include regular testing to monitor your hormones. When you first begin to use BHRT, your hormone levels should be checked after 3 to 6 months, not only to make sure that they're within the safe and effective range, but also to verify that your estrogens are not being metabolized in a way that could increase hormone-related cancer risk. Should any potentially harmful downstream metabolites be found, their production can be quickly remedied with very effective dietary modifications and targeted nutritional and/or botanical supplements. After you've been on BHRT for a year, your hormone levels are right where they should be, your estrogen metabolites are all seen to be healthy ones, and your test results have stabilized, your doctor will likely tell you that testing can be done just once yearly from then on. Bioidentical hormone replacement therapy and conventional HRT, hormone replacement therapy, are very different. Bioidentical human hormones that are used for hormone replacement in women are precisely identical in their biochemical structure, and thus also in the way they function inside our bodies, to those that a human woman produces on a daily basis. The body cannot distinguish these hormones from those it produces itself. When your body sees bioidentical hormones, it welcomes back old friends and it knows exactly what to do with them. In contrast, the compounds used in conventional HRT are alien to humans. Conventional HRT typically uses CEEs, which stands for conjugated equine estrogens. In other words, estrogens derived from female horses, specifically from the urine of pregnant mares. CEEs used to be called Premarin, a name that is an abbreviation for pregnant horse urine-derived estrogens. But this brand name, pregnant mare's urine, gross people out, and there were also many who are concerned about the harm done to the animals, the pregnant mares. So they started calling these horse estrogens CEEs, or conjugated equine estrogens. These powerful horse estrogens work perfectly in pregnant mares, but they wreak havoc on the much more delicate physiology of human females and increase our risk for blood clots, heart attacks, and hormone-related cancers. Conventional HRT combines these pregnant horse estrogens with other lab creations called progestins that partially mimic some of the actions of real human progesterone. These drug versions of progesterone are called progestins, or you may see them referred to as progestogens, a name that was devised to suggest that they have progesterone-like effects. Often the progestin used is called medroxyprogesterone, which is marketed under the name of Provera. The drug companies have now created a number of other progestins, but all of them are structurally and biochemically different from human or even horse progesterone, and all increase risk for blood clots, heart attacks, and hormone-related cancers. Since the drug companies, medical journals, and even many doctors frequently refer to these compounds used in conventional HRT as estrogen and progesterone, you may actually be surprised to learn that conventional HRT does not use human bioidentical hormones, but instead gives women one of the 3 following drug combinations. First, the most widely prescribed are daily oral doses of conjugated equine estrogens, or CEEs, combined with medroxyprogesterone or some other progestin, or synthetic estrogens like ethinyl estradiol, may be used, also combined with a progestin. And thirdly, estradiol valerate, which is the latest drug version of human estrogen, which is said to be bioidentical to human estradiol, but is actually an estradiol ester, or a prodrug of estradiol, and is again combined with a progestin. The synthetic estrogens, like ethinyl estradiol, are typically used in birth control pills, but they're also used to manage menopausal symptoms and bone loss. The synthetic estrogens are far more active than natural human estradiol because they inhibit the enzymes that are supposed to clear estrogen. So they stick around a lot longer than normal, and they have far more potent effects, which is one of the reasons why these drugs increase risk for blood clots and breast and uterine cancers. The third conventional option, estradiol valerate, is said to be bioidentical estradiol. Actually, it's an estradiol ester, or a prodrug of estradiol. A prodrug is a medication or a compound that our bodies are supposed to convert into a pharmacologically active drug. Obviously, some of us may not make this conversion as effectively as others, while some may do a better than average job of converting estradiol valerate into estrogen. Either scenario will cause problems. But the most important difference between estradiol valerate and bioidentical hormone replacement therapy is that BHRT combines a far smaller dose of estradiol with another far gentler form of estrogen called estriol. Biased, the combination of estrogens used in bioidentical hormone replacement, is typically 80% estriol and only 20% estradiol, although sometimes biased is provided as 50% estriol and 50% estradiol. Estriol is an extremely gentle form of estrogen. It is far less likely to cause problems than even estradiol. Whether your biased prescription is 80-20 or 50-50 estriol and estradiol, in either case, estradiol valerate will give you a higher than needed dose of a more potent and thus potentially harmful estrogen compared to biased. I want to reiterate that human estrogens and the drug forms of estrogen are not the same. To help clarify why bioidentical hormone replacement and conventional hormone replacement are so unlike, let's take a look at some of the key differences between human and conjugated equine or horse estrogens, the CEEs. If you had a chance to listen to my Ask Lara on estrogen, you know that estrogen is not a single hormone. It's actually a group of hormones with estrogenic activity, the estrogens, and these occur in both human women and in female horses. Even though two forms of estrogen, estrone and estradiol, occur in human women as well as in mares, the horse versions of these estrogens are far more powerful than the versions that human women produce. In addition, in horses, estrone, which is the most potent estrogen of all, makes up a much larger percentage of the animal's estrogens than it does in a human woman. Because of their much higher potency, horse estrone and estradiol cause adverse effects in a woman's body, ranging from breast tenderness, fluid retention and weight gain, to blood clots, strokes, and cancers of the breast and uterus. Notably missing from horse estrogens is the very gentle, lowest potency human estrogen, estriol, which comprises as much as 10% of normal human estrogen. Estriol is only 1/4 as potent as human estradiol, and it is only 1/8 as potent as the other horse estrogen, equilinin, or its metabolites, which constitute as much as 50% of the estrogens found in pregnant mares, and therefore in the estrogens used in conventional hormone replacement therapy. In the medical literature and on the label of conventional HRT estrogen replacement drugs, horse estrogens are called, again, CEEs. What this stands for is conjugated equine estrogens. These horse estrogens are so potent that they are not even produced by mares when they are not pregnant. Using these super potent pregnant horse estrogens in Premarin and other CEE drugs to deal with the unhappy effects of menopause, including bone loss, is like wielding a fire hose to snuff out a candle. Researchers have found that when a woman takes a CEE drug, her body levels of equilinin can remain elevated for 13 weeks or longer, resulting in a surge of estrogenic activity that is potentially damaging enough all by itself. Even more frightening, however, is the fact that equilinin gets metabolized into compounds that are 8 times more potent than any of the human estrogens, and therefore they are 8 times more likely to cause excess growth and promote tumors in the breast or in the lining of the uterus than bioidentical human estrogens. After research showed that Premarin causes endometrial cancer, which is cancer of the uterus, if these excessively potent horse estrogens are not opposed by something that can at least partly mimic the protective actions of human progesterone, the drug companies created progesterone-like compounds, which they named progestins. HRT is typically given, so conventional hormone replacement therapy is typically given as Prempro, which is a combination of the conjugated equine estrogen, Premarin, and the progestin, Provera. But even in women whose uterus has been surgically removed, Prempro is used rather than just Premarin because Premarin alone greatly increases risk of stroke, among numerous other adverse side effects, including an increased risk of invasive breast cancer, increased risk of blood clot formation, increased risk of heart attack and stroke, increased risk of urinary incontinence, and increased risk of all kinds of dementia, including Alzheimer's disease. In contrast, in many thousands of women for more than 50 years, bioidentical hormone replacement has been shown to relieve common menopausal symptoms and to help prevent bone loss without increasing risk for any of the adverse effects caused by conventional hormone replacement therapy. During menopause, bioidentical hormone replacement therapy effectively eliminates hot flushes, night sweats, sleeping difficulties, vaginal dryness, atrophy and infection, decreased libido, urinary incontinence, urinary tract infections, increased skin wrinkling, memory loss, dementia, and mood swings. And bioidentical hormone replacement safely helps prevent the long-term adverse consequences of menopausal hormone loss, osteoporosis, and cardiovascular disease. And let me repeat, unlike the standardized dosages and dosage schedules used for everyone given HRT, not only is each prescription for bioidentical hormone replacement tailored to specifically meet each individual woman's needs, but bioidentical hormone replacement therapy's dosage schedule mimics the natural ebb and flow of a woman's premenopausal normal menstrual cycle. The most recent medical studies confirm what should have been obvious from the beginning. Replacing women's waning hormone levels with estrogen and progesterone that is bioidentical to their own human hormones is a much safer and more effective way than using estrogens derived from pregnant mare's urines and the laboratory creation progestin. The peer-reviewed medical research has repeatedly confirmed that bioidentical hormone replacement therapy is more effective and much safer than conventional hormone replacement therapy. In Stay Young and Sexy with Bioidentical Hormone Replacement, that's the title of Dr. Wright's latest book on this, Dr. Wright and his companion, Lane Leonard, who's a PhD, discuss in easily understandable but not dumbed down analyses virtually all the major studies that have been done over the last 40 plus years. This is a vast amount of scientific data, and it shows both the safety and benefits of bioidentical hormone replacement therapy, and in contrast, the many adverse effects of conventional hormone replacement therapy. For an in-depth overview of this research, I've discussed just a little bit of it in this talk. Get a copy of this book. I'm providing a link to it in my summary for you. And more evidence published since Dr. Wright's book came out in 2010 confirms these findings. So let's talk about just a couple of these papers now. In a year-long study of 189 menopausal women who were given bioidentical estrogen plus bioidentical progesterone, either with or without DHEA or testosterone, bioidentical hormone replacement therapy was shown to be both safer and superior to conventional HRT to treat menopausal symptoms. 97% of these women experienced significant improvement in all their symptoms. Bioidentical hormone replacement was provided after testing to determine the needs of each woman. Then bioidentical hormones were mixed according to physician's orders by compounding pharmacists to meet the woman's specific needs. Mental symptoms experienced at entry into the study improved in 90% of the women. 60% of the women who had gained weight during menopause lost weight. The average weight loss was 14.8 pounds in these women. None of the complications seen with conventional HRT, like increased risk of a heart attack, stroke, dementia, breast cancer, developed in any of the women. An even more convincing paper is a major review that was published a year after this study, and that evaluated the evidence comparing bioidentical hormones, progesterone, estradiol, and estriol, with the commonly used conventional HRT versions for clinical efficacy, physiological actions on breast tissue, and risks for breast cancer and cardiovascular disease. This review identified all published papers on the PubMed, Medline, Google Scholar, and Cochrane databases that included keywords associated with bioidentical hormones, synthetic hormones, and conventional HRT. Research papers that compared the effects of bioidentical and synthetic hormones, including clinical outcomes and in vitro or test tube results, were selected. What did all these studies show? Patients reported far greater satisfaction with bioidentical progesterone than a progestin. Bioidentical hormones had distinctly different, potentially opposite, beneficial physiological effects compared to the hormones used in conventional HRT, which have different chemical structures from human hormones. Progestins produce a variety of adverse cardiovascular effects, which are avoided with bioidentical progesterone. Bioidentical progesterone lowers risk for breast cancer. Progestins increase risk for breast cancer. Estriol, the weakest human estrogen, has some unique physiological effects which differentiate it from estradiol, estrone, and conjugated equine estrogens. And estriol carries virtually no risk for breast cancer. Bioidentical hormones are associated with lower risks of all adverse effects, including risk of breast cancer and cardiovascular disease, and they are more effective than their progestin and horse-derived estrogen counterparts. The overall conclusion that was drawn from this very thorough review of the research was, and I'll quote, "Until evidence is found to the contrary, bioidentical hormones remain the preferred method of hormone replacement therapy." So a number of you have written in to ask if bioidentical hormone replacement therapy can be used even if you did not start right after menopause. Is bioidentical hormone replacement therapy safe for women in their 60s or even older? The conventional attitude is that hormone replacement is not safe and will increase risk for heart attack or stroke. I asked Dr. Wright about this. Was this correct? And he replied, yes, if conventional hormone replacement is what is used. No, if bioidentical hormone replacement is what is used. And it should be used correctly, which means prescriptions will be compounded for the individual woman in the form of transdermal creams after proper testing. Hormones will be applied in a manner that mimics natural menstrual cycling, and outcomes are monitored with follow-up lab tests. Dr. Wright, who has been providing bioidentical hormone replacement therapy for patients for at least 50 years now, and is considered by many to be the father of bioidentical hormone replacement therapy, sent me another recently published paper confirming its safety and efficacy in postmenopausal women. This study, which was conducted at the Women's Wellness Center in Tyler, Texas, in the United States, looked at the effects of compounded bioidentical transdermal hormone therapy on factors indicating risk of plaque or blood clot formation, and on inflammatory and immune factors, cardiovascular biomarkers, quality of life measures, and health outcomes in perimenopausal and postmenopausal women. The researchers wanted to run this study because, and I'll quote them here, conventional hormone replacement therapy results in increased thrombotic events, meaning blood clot formation, heart attacks, and strokes, and an increased risk of breast cancer and dementia, as evidenced in large prospective clinical trials, including Heart and Estrogen Progestin Replacement Study 1 and the Women's Health Initiative. And the doctors who ran this study felt that these adverse events were not due to human bioidentical hormone replacement, but to the use of conjugated equine estrogens or synthetic estrogens combined with a progestin, and that bioidentical hormone replacement therapy could provide postmenopausal women with the benefits of hormone replacement with a far safer risk-benefit profile. So they examined the long-term effects, this study ran for more than 3 years, of compounded bioidentical transdermal hormone replacement therapy, including estriol, estradiol, progesterone, DHEA, and testosterone if indicated, on cardiovascular biomarkers, hemostatic, which means markers for clot formation, inflammatory and immune signaling factors, quality of life measures, and health outcomes in both perimenopausal and postmenopausal women. 75 women were enrolled in this study. They ranged in age from 30 to 70 years old when the study began. 38% of the women had undergone surgical menopause. 35% of them went through natural menopause, and 27% were perimenopausal. Baseline hormone evaluation was performed, after which the women received compounded transdermal bioidentical hormone therapy in the form of Biest, which was 80% estriol and 20% estradiol, and or progesterone for 8 weeks to meet established physiologic reference ranges for the luteal phase in premenopausal women. The luteal phase is the second half of the menstrual cycle when our bodies are producing both estrogens and progesterone. The postmenopausal women all got both Biest and progesterone, while some of the younger women who did not need supplemental estrogen were only given progesterone. Follow-up testing was performed at 8 weeks, and adjustments to hormone regimens were made, including the addition of DHEA and possibly testosterone, if indicated. Then, study participants were again checked at the end of the year and every year afterwards. Like I said, the study ran for 3 years. Baseline, 2-month, and annual values were obtained not only for hormone levels, but for blood pressure, body mass index, fasting glucose, insulin resistance, fasting triglycerides, many key factors affecting the risk of blood clot formation, which included, actually I won't read you the whole list of these, all the important ones for blood clot formation. Key inflammatory markers including C-reactive protein, interleukin-6, matrix metalloproteinase 9, and tumor necrosis factor, and insulin-like growth factor. They also checked the women's perception of their own health and vitality using the green climacteric scale, the visual analog pain scale, the Hamilton anxiety scale, the Hamilton depression scale, the Holmes-Rahe stress scale, job strain, and home strain scale. So you can see this was extremely comprehensive. Health outcome measures also included the number of prescribed medications the women were taking, the number of comorbidities or other health problems they had, and endometrial thickness in postmenopausal women with an intact uterus. Women using bioidentical hormone replacement therapy showed significant favorable changes across the board. Positive changes in cardiovascular biomarkers, inflammatory factors, immune signaling factors, and all health outcomes. And on the psychosocial tests, despite very high life stress in some of these women at home and work, they had very, very positive outcomes. And I want to emphasize here that the antithrombin 3 levels, which are a key indicator of risk for blood clot formation and thus risk for heart attack or stroke greatly decreased at 36 months. And there were no adverse events, not a single one. The researchers' conclusion, and I'll quote, "This model of care warrants consideration as an effective and safe clinical therapy for peri- and postmenopausal women, especially in populations with high perceived stress and a history of stressful life events prior to or during the menopausal transition." Very unfortunately for the female patients of uninformed doctors, the pharmaceutical industry actively continues to try to convince physicians and the public that HRT and BHRT, bioidentical hormone replacement, which the drug companies cannot patent because the hormones used are natural, not new to nature compounds, share the same risks, and nothing could be further from the truth. Bioidentical to human hormones have significantly different molecular structures than the alien to the human body CEEs, synthetic estrogens, or estrogen prodrugs and progestins. And not surprisingly, the human body responds to them in very different ways. In some, bioidentical hormone replacement is a far safer form of hormone therapy and can help reduce your risk of clot formation, cardiovascular disease, and breast cancer, as well as osteoporosis. So how should bioidentical hormones be prescribed? First, you should be tested to determine what your current hormone levels are. The gold standard for this is a 24-hour urine hormone assay. 2 such lab tests are available, and we will go over each of them in detail in the next Ask Laras. For either test, you get to collect your urine for a full 24 hours or saturate test strips with a number of urine samples over the course of 24 hours to provide the samples required. Everything you need is provided in the test kit that you're sent. These tests will give your doctor way more information than the snapshot provided by a blood or saliva test. These 24-hour urine tests avoid the problem of the peaks and valleys of daily hormone levels that occur in premenopausal women or in women who are going through menopause, whose ovaries secrete hormones in bursts or pulses throughout the day. So saliva or blood test results give a very misleading picture. More importantly, a 24-hour urine provides accurate information not only about our levels of active estrogens, estrone, estradiol, and estriol, and progesterone, and testosterone, and DHEA, but also about whether our hormones are being metabolized properly into safe or into potentially unsafe compounds. This information is essential for postmenopausal women on bioidentical hormone replacement, and these compounds cannot be measured in blood or saliva. Your doctor will use your test results to prescribe customized doses of bioidentical hormones that you need, which will be made to order for you by a compounding pharmacy and delivered via a cream that you will apply to the labia in tiny amounts, about 1/4 the size of your pinky fingernail, very, very small amounts. And you should apply these creams in a manner that mimics normal, healthy menstrual cycling. If your cycle before menopause was 28 days, then estrogen, typically it's going to be biased, will be applied days 1 through 26, and progesterone will be applied as well on days 12 through 26. If your normal cycle before menopause was 26 or 30 days, your doctor will adapt the dosage schedule to what best will suit you. And the doses provided will also be adjusted so that you get all the benefits of hormone replacement without breakthrough bleeding or spotting or having a period every month. Initially, you should be retested every 3 to 6 months until stable, safe levels of all hormones and hormone metabolites are seen. And then every 6 months, or more likely, just once a year after that. So how can you find a doctor who is knowledgeable about correctly prescribing and monitoring bioidentical hormone replacement? Well, there are a number of organizations that can help you locate a physician who knows how to do this properly. These include the American College for Advancement in Medicine, the International College of Integrative Medicine, the American Academy of Environmental Medicine, the Bioidentical Hormone Society, the American Association for Health Freedom, and Women in Balance. And I've put all these in your summary for you. For much more information, a truly comprehensive overview of everything you could possibly want to know about bioidentical hormone replacement, read Dr. Wright's book, and I'm providing a link to it for you in the summary. In our next Ask Lara, we'll talk about the test that I use for myself, which is Meridian Valley Labs 24-hour urine comprehensive plus hormone profile. And in the following Ask Lara, I will explain the Dutch test. I hope today's Ask Lara has provided a good introduction for you to bioidentical hormone replacement and an understanding of why bioidentical hormone replacement is not at all the same as conventional hormone replacement therapy. Please send me any questions you have, and I hope you have a great week. And I'm going to sign off now if I can. There it is. Okay, stay well.